Good day mga arthritis warriors. I'm Dr. Jonathan Flordelis here to answer questions about knee arthritis. Here are the top questions of the year for knee arthritis sent from a survey, and this is all the answers that I have for you. Hope you get value from this. If you do, please share it with your friends and let me know if you are from Cebu, if you are from outside Cebu. Comment in the link below, mga arthritis warriors. We have arthritis warriors from Bohol, Leyte, Mindanao, and even parts of Luzon. In the future, if you like the question and answer portion, we will definitely be continuing this, and hopefully we can return our live. Sa mga mag-celebrate og Pasko diri sa Pilipinas, Merry Christmas to you. For those, I know there are some listeners abroad, Merry Christmas and a Happy New Year to everyone. We hope that you can learn from this, because our goal, actually my goal, is to educate and inspire mga arthritis warriors around the world. Hopefully, we can help patients with arthritis live and move better and have a stronger life. So question number 1, Doc JOF, will my arthritis keep getting worse? The biggest fear I hear is not the pain of arthritis, but the fear hadlok sila ma-paralyze, ma-wheelchair, and these are real fears. I've had one patient definitely was already in a wheelchair. No one told her that her arthritis would get this far. Ang iyang tuhod, nabawg na, sakang na siya. So from straight knees, it curved and bent until ang iyang mga tuhod, sakit na kaayo. At first, she would rely on her husband, ang iyang bana, kupta niya. Later, duha na sila sa iyang bana ug anak. Di siya ganahan magbaston. We've all heard of mga relatives, friends who do not want to be seen with a cane or a walker until it is too late, naka-wheelchair na gid siya. So, many patients believe that arthritis is a downhill path, magkagrabe. And the truth is, for some, yes, it may. For others, mas hinay ang progression, na daghan og lain-lain klase sad sa arthritis. So naay grabe gid kayo paspas. There's some patients who have a combination of arthritis and injury, and this can worsen the pain of arthritis. And yes, the short answer is definitely it can become worse. Arthritis progression is not the same for everyone. So, dili gyud pariha ang naay arthritis diri ug didto. Each patient is different. That's why we have a joint restoration blueprint that I treat every patient differently. Number 2, it is strengthening weight control that can actually slow the progression of osteoarthritis. Eating proper foods, and these are very, very simple but very important indeed. The more you gain weight, the worse your arthritis becomes. The less your strength is, definitely mo grabe sa ng arthritis. Regular checkups with your doctor can definitely help guide the timing sa inyong treatment and hopefully prevent it from worsening faster than others. So, arthritis does not control your future. The proper understanding kung kasabot mo lain-lain klaseng arthritis, nasa lain-lain klaseng doctor, your understanding will help patients improve, hopefully, and not progress or worsen ang arthritis. Again, I hope this was helpful sa inyo mga arthritis warriors. And let's go to the next question sa atong top 10 questions. Again, we're here answering the top 10 questions of knee arthritis. The second question is actually on knee replacement surgery. Doc, do I really need a knee replacement surgery, or can I still wait? Waiting is actually the safer option. Mo na huna-huna, patients think it's safer to wait, but they do not know that waiting can cost more. Inflation can change and the price of implants can also change. And that is why what happened to one patient the other day na ni doble na ang presyo sa knee replacement implants, comparing it to few years ago. And one of the things that can be the reason is inflation. A lot of patients also will have more severe defects. Kung nabuak na ang bukog, nabuslot na ang bukog, if you have bone defects, it's not a regular knee replacement that is needed. Sometimes special implants are required. And these special implants can be more costly. And going back to the question, for patients who are waiting, hoping and praying na mawala ilang pain of arthritis, the reality is maanad na sila sa pain. The pain does not actually go away. The other day, that same patient na niingon duble na ang presyo sa knee replacement initially said, "Doc, wa man ko'y pain." But later, as we tried different knee braces that improved her pain, naag yun di ay, sakit yun di ay, it's just improved with some braces and pain relievers, but the pain does not go away. You can probably tolerate more pain kay naanad naman ka from years and years of severe arthritis, nabawg na sad ang iyahang mga tuhod, concerned kaayo ang iyang mga igsuon here and abroad. And that's why we want to make sure that you understand not everyone needs a knee replacement, and the waiting is something that you can do, but it can cost you more. Waiting, when you can actually have it earlier, is also much faster ang recovery for patients who have not lost a lot of muscle. Muscle is the engine that drives the car. Changing your tires is the knee replacement, but if your muscles, your engine is not strong, maglisod og dagan ang auto. That's why please consult a doctor. Surgery is based on how you feel, how you understand your condition, and your own goals. Every patient should have a goal before I do any surgery because their motivation is important. Some will want to travel abroad. Ang uban di ganahan mabiyaan when they're just going to the mall or to church. Kay sila magsige na sila lingkod, hinay na mulakaw. And waiting too long can cost more also, like I mentioned. The best time for a knee replacement is when everyone agrees that everyone is aligned, dili mag-away-away ang pasyente o pamilya na mauning best. Kung ang patient has a goal and the family has the same goal, we work together to make this goal a reality. Ang uban na naka-wheelchair na, ang goal is makalakaw usab, that is our goal. Ang patient na ganahan mo biyahe or mo trabaho balik na di na magsakit ang tuhod, that is our goal. But if dili magkasinabot ang pasyente o ang mga relatives, atong goal is to align everyone together and not have patients fighting with their families. We align everyone so that we can give the best treatment possible. Hope this helps, mga arthritis warriors. I'm Dr. JOF, here to educate and inspire. If you found value from this message and these question and answer portions, please like, follow, and share this with your friends. So, moving on to question number 3. The question number 3, Doc JOF, is walking making my knee arthritis worse? Now, many patients stop walking. Kaya hadlok man sila. They're afraid. And what actually happens is the knees and the muscles around the knee will weaken. Dili na sila kusgan. It actually goes weaker. Movement is medicine, and avoiding this movement leads to more pain. One patient I had thought that grabe ang sakit sa iyang tuhod, nagsige na lang higda sa iyang balay. And she had not just weakness, but also bed sores. sakit na, maglisod na siya ug bangon. Remember, movement is medicine, and a car without an engine is a patient without muscle. 3 things to remember, mga arthritis warriors. Walking or moving the joints helps lubricate and nourish that knee joint. Your strong muscles protect the knee from further pain. So the weaker the knee, the more the pain of arthritis. Pain on walking will definitely need an assessment. We cannot rely sa atong mga silingan, sa atong mga kaila na murag naasay arthritis na maoy nakaayo nila ang supplement, ang tambal, because not every patient is the same. That is why we have a joint restoration blueprint. And for this question, remember that movement is medicine when done correctly. Kaya kung sayop ang exercise, more knee pain definitely can happen. Again, please like, follow, and share this with your friends. If you have a question, comment it in the chat below. So in the future, I can try to answer these questions about knee arthritis. We're now in question number 4. Doc JOF, why does my knee hurt more on stairs, especially going down the stairs? Your knee is trying to tell you something every time you go down the stairs. So remember, the stairs put more pressure on the joint, on the kneecap, ang tuway-tuway, ang patella. The thigh muscles, the kneecap, will show that going down the stairs, 3 times the force is required. And that means sometimes you have more pain going down the stairs in cases of severe arthritis. Muna sakit, magnaog ug hagdan, mukupot gyud. We have to hold on para ma-lessen ang force sa tuhod, ma-lessen ang pain. That is what happened to a lot of my patients. Bisag dili stairs, bisag kanang dulhog. The lady the other day, mukupot na gyud sa iyang mga anak. And remember 3 things. The stairs can show you that you may have a muscle imbalance and muscle weakness. Quad muscles, ang muscles around the thigh, very important. And physical therapy can also lessen if you are given the proper stretching and the proper strengthening exercises. Remember that this pain can give you clues na nag-worsen possibly an inyong arthritis. Always listen to your pain and consult a doctor, mga arthritis warriors. And right now, if you're getting value from this, do remember we have a Facebook group, Hip and Knee Arthritis Cebu Facebook group. If you have questions, concerns, we also have a dedicated chat group where you can share what your feelings are, or you can try to get hold of me or my staff for appointments. Remember, every patient is different. And we're here to educate and inspire mga arthritis warriors. Hopefully, you can get better and dili mag-worsen o grabe ang inyong arthritis. So, we're here to question number 5. Doc, are injections okay for me and my knee? So, if you're thinking that injections are better for you compared to surgery or medicines, it actually can help some patients. It can give temporary relief that can feel like a solution. Kay there can be big pain relief, especially for mild and moderate. But when you have severe arthritis, that is the point when the injections stop working. I've had patients who have been, one man had been to so many different doctors, injected by orthopedics, rheumatologists. For some reason, he wasn't actually advised a knee replacement surgery. So he had multiple injections done, balik-balik. It initially worked, but then nagkagamay ang effect to the point where he felt depressed yun na wala na siya pag-asa because he wasn't offered a knee replacement surgery. Remember, knee replacement surgery is not for everyone, but it is indicated in patients with severe knee pain and severe arthritis. When nothing else is working, this can be a good option. So remember, injections can help, but they don't fix the joint, they don't fix the problem. It can give a symptomatic relief. It can have a limit, dili siya forever magsige og injection. And surgery can be considered for patients who are active, who want quality sa ilang life, who want to travel again without the pain of arthritis. Remember, relief from the pain is good, but resolution of the problem is actually better. So, hope this helps mga arthritis warriors. Again, I'm Dr. Jonathan Flordelis, here to educate and inspire. If you've had any injection before, let me know in the chat, nakatabang ba? And how many times you've been injected. If you're from other parts of the country and have questions about injections, comment in the chat below.